We move on to our next speaker, Dr. S. Sasikumar from Sri Lanka, who will delve into en-bloc bladder tumor resection. Over to you, Dr. Sasikumar.
Very good afternoon to you all. And the topic is en-bloc bladder tumor resection. As you all know, the non-muscle invasive bladder cancer management involves effective initial TURBT, which gives out good oncological outcome. The conventional TURBT that involves piecemeal resection or separate resection of the exophytic portion of the tumor and thereafter resection of the deep part and the adjacent areas, which involves monopolar and bipolar electrocautery. So there are several shortcomings of conventional TURBT, which involves ignorance of basic principles of oncological surgery, that means the risk of tumor feeding, and the absence of tumor muscle, detrusor muscle in the specimen that give rise to high risk of residual disease at the site, and there is a possibility of early recurrences and tumor understaging because of the tangential sectioning and the thermal artifacts of the conventional TURBT. And there is a high chance of go for a second TURBT because of incomplete first resection, particularly for the high-grade TA and all T1 tumors, which give rise to additional cost of the procedure and the further addition to the complication related to the TURBT. So when we consider the en-bloc resection of tumor, it tries to address the limitation of traditional or conventional transurethral resection of bladder tumor. But it is feasible in selected exophytic tumors. At the same time, we have to consider the size of the tumor and the number of lesions and location of the tumor when we decide to go for en-bloc resection of tumor. And there are various energy devices used to go for en-bloc resection of tumor, which include monopolar, bipolar, and laser. It can be colmium, thulium, or KTP. And the hybrid knife, which involves hydrodistension and the electrocautery. So all these energy devices can be used to go for an en-bloc resection of bladder tumor. The technique involves, as usual, inspection of the whole bladder to look for the number of lesion, diameter, and location, and choose the energy modality, and marking the circumferential margin and incision away from 0.5 to 1 centimeter away from the macroscopic tumor margin. And blood vessels entering the tumors are blocked and incise down to the deep muscular layer. And the base of the tumor is lifted and pushed away step by step, and the tumor is resected in one piece in a retrograde fashion rather than the conventional TURBT which involves antegrade motion. So ERBT technique assumes having following advantages. It gives a proper histological assessment and more controlled resection procedure and avoid the tumor fragmentation. So there are a number of studies related to the comparing the conventional TURBT versus en-bloc tumor resection. The 29 studies include 13 randomized controlled trials, and which shows it is beneficial with regards to detrusor muscle presence and the lower rate of residual tumor at repeat TURBT, and risk of bladder perforation also much less. And when you consider the recurrent risk, the meta-analysis reveal there is no statistical difference with regards to recurrence risk. There is another systematic review that includes 7 randomized controlled trials, again that conveys the message regards to the complications and the residual tumor and the TURBT rates, or favors towards the ERBT, but considering the recurrence rate, there is no statistical difference. But there is a meta-analysis that includes 9 trials, but it includes only 1 randomized controlled trial that shows there is a significant better recurrence rate compared to the conventional TURBT. And there is another multi-center randomized controlled trial, the recent trial that includes 276 patients, that also shows a recurrence rate at 1 year is improved with the en bloc resection of bladder tumor. So there is some controversies regarding the recurrence rate. Other than that, there is more beneficial effect towards the en bloc resection of bladder tumor. And there are various modalities used with regards to laser, regards to ERBT, but all conveys the same results and improve detrusomafil present, and there is and majority of the recurrences occurs outside the side of the previous ERBT. Then the practice of ERBT among urologists, there is a recent survey among 200 European urologists reported the en bloc tumor resection technique is choice in 35% of their bladder tumor cases with related to non-muscle invasive bladder cancer. For summary, serve as a feasible and efficient option for treatment of non-muscle invasive bladder cancer, and complete removal of tumor is possible, and provide adequate specimen for pathological grading and staging, and decrease rate of perioperative and postoperative complication, and decrease the number of second TURBTs, and there is a reduction in recurrences that need further evaluation and further studies. Thank you.